Good morning, or whatever time of day you are watching this video. Okay, so now we're on Unit 2, and with Unit 2 we start off with Chapter 20, and this is the lymphatic system and lymphoid organs and tissues. So why does this chapter matter? Why is this important? Why should we understand this? We should understand the structure and function of lymph nodes because it's going to help you later on to evaluate patient for signs of infection. So what the lymphatic system does is it returns that fluid that leaks out of blood vessels back to blood. And if you remember, we talked about this. So it goes from the heart, right, then out the aorta. We're talking about the part, the systemic circulation. So it goes out the aorta and then down the arteries and eventually getting to the arterioles. From there, it gets into the capillary beds. So in the capillary beds, about 20 liters of fluid is going to leak out, and this is going to provide the way that the tissues are going to get their nutrients and their oxygen and all that kind of good stuff. And whenever the fluid, when you get back towards the venous side of the capillary bed, that's where the fluid gets picked back up. About 20 liters leaks out, and only about 17 liters, comes back in, which leaves 3 liters of fluid. And so what this lymphatic system is going to do is it's going to return this fluid, this 3 liters of fluid, back to the blood. And the lymphatic system itself consists of 3 parts. So we have the network of lymphatic vessels, the lymph, which is the fluid that you do find in the lymphatic vessels, and then lymph nodes. And lymph nodes cleanse the lymph. And we're going to talk about each one of these in a little bit more detail. Lymphoid organs and tissues provide the structural basis of the immune system by housing phagocytic cells and lymphocytes. And then the structures that we're going to talk about include the spleen, the tonsils, the thymus, the lymph nodes, and then other lymphoid tissues. We'll talk about Peyer's patches and other things. So the lymphatic system, like I said a moment ago on the last slide, is going to return that interstitial fluid and leach plasma proteins back to the blood. And it's going to do this via lymphatic vessels. And they're just an elaborate network of drainage vessels. And I'll show you a diagram of kind of what you would see if you were to look at like a capillary bed and the intertwined lymphatic vessels. And it circulates about 3 liters of fluid a day. And once that fluid enters the lymphatics, it's now called lymph. The lymph vessels are a one-way system that is going to ensure that lymph flows only toward the heart. So whereas with systemic circulation, we're going from the left ventricle, we're circulating around throughout the body, and then it's coming back to the heart, and it's going to continue to circulate. The lymphatic system is a one-way deal. It's going to pick up fluid from around the capillary beds, and it's just going to deliver it back to the heart. It's not going to continue to circulate continuously throughout the body. Lymph vessels include lymphatic capillaries and larger lymphatic vessels. And then the lymphatic capillaries are a little bit different than blood capillaries. And I think we'll talk about that more on the next couple of slides. But what they are is they're blind-ended vessels that weave between tissues and blood capillaries. So I said that on the last slide. It just kind of weaves through the capillary beds. These lymphatic capillaries are absent from bones, teeth, and bone marrow. At one point, it was thought that they were absent from the central nervous system. They are now, it's known that they are there, but they're found in limited locations in the meninges. So lymphatic capillaries are similar to blood capillaries, but they're more permeable. They can take up larger molecules and particles that blood capillaries cannot. For example, proteins. Blood capillaries cannot pull proteins back in. Cellular debris, pathogens, cancer cells. And what it also does is it acts as a route for pathogens or cancer cells to travel throughout the body. So what you would see is you would see a capillary bed. So again, let's look up here. Circulation, systemic circulation would be heart, arteries, down to the capillary bed, drop off oxygen, nutrients, pick up waste, carbon dioxide, other things, hormones, whatnot. And then this fluid is supposed to be picked back up, and then it goes back to the heart. The lymphatic system is going to be found kind of intertwined in here. It's going to pick up the remaining 3 liters of fluid, and it's going to deliver it back to where it can go back into the venous system and then eventually get back into circulation. So the lymphatic capillaries have increased permeability because of 2 different specialized structures. One is that endothelial cells do overlap loosely to form these one-way mini valves. And then this may be a little bit difficult to picture, and there's actually, I believe the next slide is an image of it. But these mini valves are anchored by collagen filaments to the matrix. So whenever there is an increase in extracellular volume, and that's what ECF means, extracellular fluid volume. ECF stands for extracellular fluid. It's going to cause the mini valves to open even more. However, a decrease in extracellular fluid volume is going to cause the mini valves to close. And then we also have these things called lacteals, and these are specialized lymph capillaries that are present in the intestinal mucosa. And what they do is they absorb digested fat and deliver this fatty lymph called chyle to the blood. So with the special lymphatic capillaries, these are the endothelial cells, and they're just loosely overlapping. So what can happen is you have these anchors here, right? This is anchored to this tissue on the outside. And whenever the extracellular fluid volume goes up, it's going to put more pressure on this, which is going to cause these to pull. And when they pull, this is going to open up and allow fluid to flow into the lymphatic capillaries. Notice that they're blind-ended, which means that the fluid only has one way to go, right? So it only can go back up. There's no way for it to go the other direction. So larger lymphatic vessels, so lymph capillaries are going to drain into increasingly larger vessels called collecting lymphatic vessels. These are going to consist of collecting vessels, trunks, and ducts. They have structures and tunics similar to veins, except their walls are thinner. They have more internal valves, and they anastomose more frequently. So remember, veins do anastomose, which means that they kind of branch off, which allows alternative pathways. But lymphatic vessels anastomose more frequently. Collecting vessels in the skin travel with superficial veins, but deep vessels travel with arteries. Then we have lymphatic trunks, which are formed by the union of the largest collecting vessels, and they're going to drain large areas of the body. They are named for regions of the body they drain. I do not expect you to know this. You may need to know it for lab. I haven't seen the lab for the lymphatic system yet. So, but for here, you do not need to be able to identify these. I just wanted you to know that we had, there are paired lumbar, bronchomediastinal, subclavian, jugular, and then a single intestinal. What's important to understand from this slide is that collecting vessels are going to then converge and go into lymphatic trunks. And then lymph is delivered from the trunks into one of 2 large lymphatic ducts. So there's the right lymphatic duct, which is going to drain the right upper arm and right side of the head and thorax, and then the thoracic duct, which is going to drain the rest of the body. In about half of people, it starts off as an enlarged sac called the cisterna chyli, and I'll just show you what that means here in a second. But each empties the lymph into venous circulation at the junction of the internal jugular and subclavian veins on its own side of the body. What this is just showing is that the right lymphatic duct draining over here, the thoracic duct over here. And then this is showing that the right lymphatic, so this color here, this tan-ish, I don't know what color you'd call that, greenish tan, I don't know. It drains this part. So from here up, right, that's what's drained by the right lymphatic duct, and then the thoracic duct drains the rest. This is also showing a little bit of the kind of circulation pattern in the lymphatic system through the body, and this is the cisterna chyli right here, that enlarged sac that 50% of individuals have. So the lymph system is a low pressure system like the venous system, and it's propelled by the same mechanisms. So if you remember when we talked about the ways that blood is returned in the venous system, it's done by things like the milking action of skeletal muscle, the changes that occur during breathing, the valves to prevent backflow. Now, with the lymphatic system, there's also the pulsations of the nearby arteries and contractions of smooth muscle in the walls of the lymphatics. And physical activity does increase flow of lymph. So, in the event that you had an area that needed faster healing, you would want to immobilize it to keep that inflammatory material in that area. These are your questions for this first part. That's all I have for you.